This is ASOSU Presents, Damn, What Now? Navigating Student Identity During a Pandemic with Ammara, Safi, Halli, and Hannah.
Hello and welcome back to another episode. My name is Ammara.
My name is Safi.
I'm Halli.
I'm Hannah.
And today we're going to be talking about health care and health insurance, specifically among college students, and then look at how that relates to COVID-19, and then also examine some health disparities that are present in healthcare, health insurance, and in times like these. So today we have two special guests. We have Ebado, who's my co-host today. If Ebado wants to go ahead and introduce yourself.
Hi, my name is Ebado. I'm a second year at Oregon State. My pronouns are she, her, and hers, and I'm the coordinator of Multicultural Affairs for ASOSU. That's about it.
Nice. And then we also have Kolade, if he wants to go ahead and introduce himself.
My name is Kolade Salaudin. I'm a junior studying communications at Oregon State, and I'm a student athlete, and I'm also the coordinator of international affairs at ASOSU.
Nice. Okay, so as always, we are going to begin with a feel-good story. So if Hannah wants to go ahead and share that.
Oh my gosh, y'all. Okay, so I went through quite a few to figure out what I was going to talk about today, but I decided to peruse the hashtag Team Oregon. I don't know what it is. It's like a hashtag on the Oregonian, which I thought was really cool. And I found 7th grader Melanie Gabriel, and she happens to be a Girl Scout. So again, Girl Scouts are coming through, everyone. But she started doing research on a bunch of different topics that she just wanted to learn more about, and she was interested in, and one of them was gardening. So she got really interested in victory gardens, also known as war gardens, and she decided she wanted to start a COVID-19 victory garden in her backyard. And so she had been saving this money for a trip to go to Japan, but she decided she wanted to try and encourage other kids to grow gardens and make food for their families. So now she's created this competition for kids under the age of 18 to make gardens and then send them to her. And these winners will be picked based on what they learned from the project and the creativeness of their gardens. And so there's going to be one winner from now into every month from now until September, and each kid will get a $100 grocery card to buy groceries with. And she was like, I recognize that some families might not have space for gardens, so she's also allowing people to make diagrams or draw gardens and show what they would like to do in a garden. So I thought that was really cool. And so yeah, that's our feel-good story. It's just this 7th grader who was like, I'm gonna make a garden, and she just got inspired. And I just thought that was really cool and a great way to get kids involved in gardening and get them excited about growing their own food. So yeah.
I love it. Girl Scouts coming in clutch again.
That's pretty cool. What do they define as a kid? Because I'd want to be a part of this gardening club.
Somebody under 18, but I'm sure you could appeal. You could be like, listen, I'm a college student. Actually, you're not anymore, really. You're no longer a college student.
Yeah, graduated.
Can we vote though? Because how do you pick winners? I want to vote.
I think she picks.
Yeah. Good to know. I'm tracking.
But if you know any kids who want to grow a garden, connect them. We'll have the link in the description. I don't know, wherever the link goes.
That's awesome. Thank you for sharing that, Hannah. So the next thing we're going to do is a quick icebreaker. So today's question is, if you could live in an alternate universe, which would you live in? And so obviously an alternate universe is anything you want it to be. So it could be something like the Marvel universe, or a universe where you live forever and eat donuts or something. So I guess I'll start. I feel like it's not really a question. I would live in the Harry Potter universe.
Everybody knew that was coming.
So if y'all want to tell me which universe.
Our Last Airbender. I want to be an airbender. I want to be an airbender. I want to be a waterbender. I want to be it all. Like, I want to be the Avatar. That's the life I want to live. No, but that'd be really cool to live, like, I don't know, like in the Fire Nation or something.
Nice. I like that.
What if I told you I'd never watched that show?
Honestly,
Well, it's on Netflix, so go watch it.
Safi?
Halli, that's the right response.
thank you.
Safi, I don't believe it.
I was also gonna say Avatar, and I was wondering if I would be Ebado to the punch, but I did not. So I'm gonna think on another one. Think about it.
I would do Marvel. That would be mine. That would be the universe that I'd want to live in. Obviously, I wouldn't mind being Thanos, but then maybe be one of the good guys, probably. One of the ones that don't die.
Why do you want to be Thanos? Like the worst
I don't know.
one.
Like, seems like an interesting character in what he's been through. He's been through a lot. And
Maybe you'd like make different decisions than
yeah, I never set out to make the same decisions as Thanos. I just want to be him.
Nice.
Uh, I'm gonna go off Safi and say Marvel as well, but I'd want to live like the Iron Man.
Oh,
Yeah, he's
Tony Stark.
He's just
Tony Stark.
good. Yeah.
Or I guess I shouldn't say anything because if I don't know if people have watched it. I get too excited about Marvel.
All right, Hannah and Halli.
Oh, I don't know, man. I would also have said Marvel. I feel like that would be really cool. Just because, like, I'd kind of want to live in that world where superheroes just like save the day. Like, I feel like that'd be pretty cool. Because I was like, what shows do I watch? And I was like, I don't know. The shows that I watch are like regular people worlds, and I feel like I wouldn't want to. First, I was like, The Good Place, and I was like, but then that's gonna make it seem like I want to be dead. But that's not true. but I would love to live in The Good Place because I would love to try all the yogurt, like the frozen yogurt that they have. You know, like that sounds really fun.
A great show. Love it.
It's such a good show.
Well, since Ebado took mine, I'm gonna go with actually I'm gonna go with Percy Jackson and the Olympians. I love
This is why you're my guy.
I
Why you're my guy.
wanted to be a Greek goddess. Would love that. So that's what I'm gonna go with.
You are a goddess, Halli.
Nice. Okay, so we're gonna transition into talking about healthcare. Woo! So basically, the idea for this podcast came because Ebado and I were planning a health inequities and social justice symposium this term, but obviously with coronavirus and everything, that did not happen. So we're gonna be doing like a little episode on it instead. And so I'm just gonna start with like talking about like how the healthcare system in the US works. And then we'll transition into talking more about college students and COVID-19. So I'm just gonna like read a little bit about what the healthcare system in the US is like, because it's very complicated. And it's one of the worst in the world as well. So a 30 to 40 minute podcast would not give you everything you need to know about our healthcare system, but we will try to give an overview. So unlike most developed nations, we don't have universal healthcare. So this means that our healthcare system is a combination of both the public and private sector, with the majority of healthcare delivery systems being privately owned. And so this means that companies who are solely market-minded usually, and they're unregulated, they're able to set prices. And as you can probably tell, that like this is where a lot of issues arise. And so basically in the end, this culminates to individuals bearing the burden of ensuring that when they get sick, they themselves will be able to pay for it. And if they can't, they will most likely stay sick or die. So the United States healthcare system is often called a sick care system. which Ebado will touch on a bit more, but that basically just means that like people come when they're sick, and they need care. And so like the care that they get is usually expensive, or if they're even able to access that care. So that's a lot of where the problems arise too. And so America spends 17.8% of its GDP on healthcare. That's more than any other developed nation, but we actually experience some of the worst health outcomes, and we have some of the lowest quality care in the world. And so the reason that medical costs in the US are so high is because even when prognosis is poor among like patients, we still will treat them. And like you can't really refuse to give care, while in other nations they'll be like, your prognosis isn't good, so you need more like palliative care or something like that. And so also we have a large number of malpractice lawsuits, which basically means that doctors will overdo what they do so that they don't get sued in the future. And for those of you asking, prognosis means basically like what you have. I don't know how to explain it better than that. It's basically just like what kind of like your ability to overcome the disease you have or sickness you have or things like that, kind of like what your health outcomes are. I think that's a good way to put it. And also there's no competition in healthcare. So that means that corporations are able to thrive unregulated. And so I'm sure y'all have heard a lot about big pharma. That is a whole nother podcast, but it's basically just companies are able to set their prices, and they're able to decide like basically decide the market and like how much people have to pay. And so the first step in kind of like helping people navigate the healthcare system and access it better was Obamacare, which was known as the Affordable Care Act. And it was a huge stepping stone in making healthcare more affordable by helping the uninsured and underinsured. Obviously, there's still a lot of gaps to fill, but the Affordable Care Act had three main goals. It was to make healthcare more available to people by lowering costs for those under the poverty line. It was also there to expand Medicaid programs to cover more adults that were below the poverty line. And it was also there to support like innovative medical care to lower the costs of medical care. However, once Trump took to office, he made every effort to repeal the Affordable Care Act, and he was actually successful in some aspects. So he repealed the individual mandate, which basically was a part of the Affordable Care Act that told people that you need to like buy some form of healthcare. And so since Trump took office, the rates of uninsured Americans has gone up significantly. A fun fact is that in 2018, 27.9 million non-elderly Americans were uninsured, and this was a 500,000 person rise since 2017. And with the addition of COVID-19, Ebado going to talk a bit more about this, but the number of people who have like filed for unemployment, or the number of people who just like applied for benefits, they aren't able to like be insured. So the number will only continue to rise. And so another fun fact is that 1 in 3 GoFundMe pages are actually related to medical care costs.
Wow.
Which is, yeah, it is pretty sad. So yeah, that's just kind of the healthcare system in America. And you probably are wondering, like, how does this relate to college students? Well, more than 19 million young adults lack basic health insurance. And with the additional fear of COVID-19, many are left wondering what will happen to them. And so we all come from kind of different aspects and like walks of life. And so kind of what we wanted to talk about in this podcast was a lot of our own experiences with healthcare, and then kind of like what we think the impacts of COVID-19 will be. And so I wanted to start with Kolade, who is going to talk a little bit about the barriers to health insurance and healthcare that he's kind of noticed with international students, being an international students, working with international students, and then also as an athlete. And also, I think it's interesting that Kolade is from England because they have the NHS, which is like a universal healthcare system. So if he wants to give a little on that too, he can.
Thanks for that, Mar. I've noticed quite a few differences in the healthcare system and just the lifestyle in terms of the way young in comparison to England and America. So like in England, there's the NHS, which is basically like a universal healthcare for every single person within the country. So if I was to get ill today or something happened to me, I could pick up the phone, go to the doctor, and get every single thing that I needed done, and I wouldn't have to pay a penny. But the way the system works is that from everybody's salaries, the tax that comes out goes back into the system to obviously keep the NHS running, which is why there's different tax brackets, obviously in England. So the more you make, the more you get taxed. So that's how like they keep the healthcare running in England. And personally, I think it's very beneficial because it takes away a worrying factor in terms of like your lifestyle kind of thing. So when people are ill back home, they know they don't have to worry about anything. In comparison to how I've noticed the changes in America and working with international students, I've seen different instances where people have been going through situations and they couldn't take care of it because they didn't have the financial capabilities to do so. So two examples I'll give is one of my friends who isn't a student athlete was literally just playing sport and he tore his ACL. And anybody who knows what ACL is, that's like in the professional athletic system, that's at least 6 to 9 months out, and you have to get special types of operations and everything. And he couldn't do so because it would have cost him and his parents quite a lot of money. And obviously, like if this was in England, he would have been able to get the healthcare he needed because he was obviously a resident at the UK at the time. But obviously in America, he would have to pay for that treatment. So he had to literally get what he could afford, which is just basic physiotherapy and just have a cast around his leg. And till today, I don't think he's got that operation that he needed. And obviously, like that's a struggle that some students face. In the athletic world, if you're not really an athlete who's on a full scholarship or anything, it's quite difficult and you're exposed to a lot of injuries. And one of my teammates was going through a serious injury and he wasn't on a full scholarship, so healthcare couldn't really help him out or anything. And he was carrying on this injury and playing for quite a long while. And obviously he's an international, and in terms of conversion rate, it can be quite expensive to do so again. So it kind of shows that finances, it plays a big role. And I think when you speak about both of the countries, I think that worrying factor of worrying about, oh, if I get sick today, am I going to be able to afford it or anything? I think that factor is taken away from the British people's lifestyle. And I think if that's incorporated into the American society, I feel like it'll just make life easier for people. And in terms of salaries, people are able to save more money and all of them sort of things. So those are the sort of things that I've noticed in terms of healthcare that's obviously been going on with international students and a comparison between England and the United States.
Mm-hmm. Yeah, that's another thing is like people will come when they're sick, and usually when they're sick, they have to pay more. And so there's not really like that preventative medicine available in the United States because people don't want to go and like, pay for it when they're already sick.
Yeah.
So that's a good point.
That's another reason why I feel like England wanted to do the whole Brexit situation, because, England were in the EU, and like people could come in and out of the country, get whatever they needed and just go back to their home country. And some people obviously decided to stay. And it is, for me, I personally think it's definitely an important part of Britain, and it kind of, impacts the economy, because that, for example, like my mom's had loads of operations, and if she didn't have those operations, we wouldn't know where she'd be today. So I feel like, yes, it's important, but there's got to be a way to kind of manage people coming in just for treatment and stuff. And yeah.
Yeah, that's really interesting. I know, Halli, you work in a hospital, so kind of like what have your experiences been with, especially like in this coronavirus kind of pandemic?
Yeah, I think it's fascinating because I think all of us like objectively think if I'm sick, I'll pay for everything and like figure that out later. Just do what tests you need to kind of get through it. At least that's been like my mindset. I've never had to be in that situation, thankfully, but there's so many times, and actually just one, I think last week, where patients will just tell you flat out, I don't want the testing. I can't afford it. And in that situation, you know, they have different care management consults and try to figure out ways that they can manage payments and things like that. And it's really nice to see some of the physicians that will say, can I get the same answer or the same thing I'm looking for with a really cheap test? But it's happened a lot. And I just had someone last week who said that they were in the hospital for coronavirus recently, but had come back for something unrelated to the coronavirus. And she had denied further testing that was really, really encouraged. And it was really, really frustrating to see because it was, she had talked about like, my insurance can't cover that. I'm already drowning in medical bills. If I add something else, then that's it. I can't afford it. I can't stay afloat. I have a daughter at home. And so it was really upsetting because she had ended up leaving with only 1 or 2 tests when really, given the symptoms that she had presented, should have probably been admitted, and she refused it. And that's just like a situation where a doctor can only do so much because they don't control the insurance. And so it's really upsetting, especially right now. Really frustrating. And, you know, like my mom has very good health benefits, but it's definitely changed as I've been out of state. If I were to get any injury here, unless I go to the emergency room and like get admitted, my insurance won't cover it. So I can't, if I got in a car accident and didn't go to the emergency room, but still had pain, I'd have to pay that all out of pocket just because I'm not in the state that my insurance is covered in. So not even just, I mean, Kolade brought out international stuff, but even just across states, the health insurance doesn't cover you the same way that it would in your own state. And you see people do that all the time. You know, you have travelers that are like, oh, I'm here to visit my family. I didn't want to come to the hospital because it's really expensive. And so it just takes so much longer, so much more resources, an overall more expensive bill because you're trying to figure out how you can best serve them. But at the same time, the longer they're there, it's more expensive. And so it's just a really big catch-22 and conundrum that I see every day. And I just always wish that like there was something more that you could do about it.
Yeah, I'll go next. I think Halli brings a really unique perspective because, I mean, she works in the hospital, and and brings up things that like I might not think about, like physicians like trying to find ways to have cheaper tests for people and recognizing people's struggles. Like I really appreciate that that's happening, and I mean, that's incredible that people are thinking about folks. I grew up really poor, so I've always been on, like Oregon Health Plan, essentially, my entire life. And I've been really lucky that I have that. I can't even imagine not having that. I have not had a lot of health issues. My mom has had a lot of health issues. And I think she started, probably with benefits at one of her positions that she's had at her job. But she got really sick and she lost her job. And so if we hadn't had the insurance that we did have, like if I didn't live in Oregon, like there's a big possibility. I mean, I guess every state has their healthcare plan, right? But we're really lucky that we have health insurance. And I think that we're probably on, some people are on that cusp of if they are eligible for the state's insurance or if they have to have like insurance with their employer. But that's a big issue, is having that tied to your employer. I mean, when you lose your job, you lose your insurance. So I know that I had a health issue this last fall, and just knowing that like I was a student who luckily had health insurance so that I didn't feel like I couldn't go to the hospital. that's so scary to have to think about. It was almost like, my mom was just like, Hannah, you have insurance. We're one of the lucky ones. Like, you can go and get this checked out. And I was really lucky. And I'm so thankful for my mom, who has health issues, so many health issues, so that she can go. And I mean, I imagine, like, my sister has a really great job and she's really comfortable, but her insurance is still tied to her employer. So if anything were to ever happen, I mean, that would be awful. So yeah, health insurance is a big issue. I really want to learn more about it in terms of how it relates to policy and politics. So I'm really digging this episode today. That's all from me.
That's a really good point that you bring up too, is just like what do people do if they're like on their own, you know, like if they don't have their parents' insurance and things like that. So that's where policy is really important as well. Yeah.
Yeah, and then also just the fact that, you know, like you mentioned a point that you have to think about the cost of healthcare, which to me, in my mind, is like you should be able to get your body taken care of without any like hesitance, is like just my idea of what it should be. But you know, like that's another thing, is like a factor into your decision making, which it shouldn't be, in my opinion. The other part about that is like, yeah, like similar to like what Hannah was saying, but also different, that, you know, my parents are has their own small business, and so they don't have an employer to like look at and to like get that benefit from. And so that's another part where, you know, like that's something that our family has to pick up through our own thing. And then I had a family member who, you know, needed to go to the hospital, but opted to like wait it out for a long time before they went, just so that they could like see if they would pass, so that they wouldn't have to like have that like cost come upon to them. So those were like some of the things that, you know, like have experience. And then my roommates over here, they both are international students too, and so they, you know, are very limited to the plans that they can pick, and most of them are really pricey plans that they're going to be paying for. And then, you know, and that to them, like being young and healthy, those pricey plans might not be the most beneficial ones that are there. Like there are other cheaper alternatives available to like non-international students, but like they're not eligible for it for certain cases, which is, you know, not a fair system in that way. But it should be still available to them because they're just trying to, you know, stay healthy. But that's, yeah. And then as far as an alternative universe goes, I could see an alternative universe with all this available being great.
Yeah, and I'm joining.
Same. Yeah, that's a really good point. Thank you.
Yeah, no, I see that like everyone's kind of echoing the same thing, that we're all just like worried about, oh, how can I get, you know, I can't even go to the doctor without thinking about the costs of it. And I think that obviously we all know that health disparities impact communities as a whole. And like research has shown that people in like low income situations and people who are uninsured have worse health outcomes and receive less preventative treatment and care. Like no one's going to go to the doctor just to get a checkup if they can't afford it. You're only going to go if you're sick, like Ammar was saying. But even with these health disparities, they are more prevalent with COVID-19 going on. Some research has shown also that 30% of adults are from the ages 18 to 19 are unemployed, as well as 25% of adults between the ages 20 and 24 are unemployed. And sometimes when we think about employment, we like health insurance is usually tied to your employer, and seeing as about 30%, 25% are unemployed. What do you guys think kind of the future of our healthcare for our generation is going to look like based off of these like statistics? Maybe we can go Safi, or whoever wants to go first, and then chime in whenever.
I mean, it's definitely scary, like hearing all those numbers. Like, I think the benefit of, you know, doing like everyone pays into one system is like the general cost goes lower. And so because each person's picking up a little bit of the slack, like similar to what like the National Health Service, like the NHS in England or in the UK does, is like, you know, everybody pays into it a little bit. And so everyone then has an equal opportunity to take advantage of it. And so that cost gets subsidized. So yeah, like it's scary when you see those numbers, that those numbers are increasing, and that the fact that there's more uninsured people. So that means the people who are insured have to pick up the slack or pick up the cost of the people that are uninsured. So yeah, it's definitely worrying to me, at least.
I think about like us as most of us are graduating, like And a lot of places a lot of fields that we're trying to apply to aren't hiring, right? And like, as you said, our benefits are mostly tied to employees. So if our generation isn't getting jobs, then where's our benefits coming from as like young individuals?
Right.
And so I think about that, and that's just daunting to me. I just, so frankly, and I don't, like, this is probably not the best answer, but it kind of makes me just not want to think about it, which is a horrible thing to do. But the stress of that in the middle of a pandemic, and to think about like that future, I think if it causes me anxiety, it probably causes a lot of other people anxiety. So I just think, of course it's going to go up, right? We're in a pandemic. It's an unjust healthcare system. It never worked, and I think this pandemic is just exploiting how much it doesn't work. So for our generation specifically, and like our age who are trying to go into the career field, I'm very nervous for all of us, but I think all of us are resilient, and hopefully we can find something that works for us.
Any comments?
I think ultimately there's just going to be a lot of strain on state healthcare, like healthcare departments and agencies. Like every state kind of has their own healthcare insurance and agencies. But with coronavirus, it's just putting a more of a strain on our states, including funding issues. I mean, we just currently don't even have, I mean, when we're looking at these budgets that just came out, like the budget forecast that just came out today, and thinking about how states are going to be able to help pay for our underinsured and uninsured folks who now don't have jobs, who have the inability to go safely to get their health checked up. Like right now it's scary, and that's where federal policy needs to change, because states can't take it out all on their own. Like they can't handle it all on their own when this is not just affecting a state by state basis. This is a whole nation, whole world we're talking about. So that's my 2 cents. Is just, I think about like the state issues as well.
I think for me, when I think about like all of this situation, I just think of it as like financial gain for some, and like other people suffer during the time, because at the end of the day, we're in a place where we have the technology to do a lot of things, but you know, finance makes the world go around, you know what I mean? So I feel like there's definitely steps that can be taken to kind of make the lives of people our age a bit easier. But I also think that some people see it as a time of opportunity, but I feel like those in power can obviously make the change.
Agreed.
Yeah, no, for sure. I think that the healthcare system definitely puts profit over people, and I think that's one of the reasons why I decided to go into the healthcare field. But kind of going back to what Hannah was saying about policies and stuff, one thing that through our research that we found was COBRA, which is an act that it was created in like the 1980s, but right now it's kind of been a hot topic because of what's been happening. They provide healthcare assistance for workers and families who lost their health benefits. Like if they get laid off from a job, then this is a way for you to still receive healthcare insurance if you were like insured by your employer. And even now with COVID-19 going on, there's new regulations and elections to kind of benefit people who lost their jobs. So that's something cool that I've kind of saw, and I know that like something uplifting to kind of think of is that there are programs and federal policies that in place help people during times like these. And so I encourage anyone who's listening, if you are like in that situation, to look into that. They can actually provide like up to 18 months of coverage, like healthcare coverage. So that's pretty cool. Some other resources
is that only for like people who have lost a job or furloughed or laid off, or what is like the, I don't know.
You have to actually, I think the furlough, is that how you say it? I read about that. They don't cover that, but they covered only people who like actually lost their job.
Gotcha.
Yeah, and then you can apply after. But they like change the regulations just differently to just accommodate people, especially because of these times. So there's also, for students who are, suffering during COVID-19, we have Beavers Care, which is the ASOSU Foundation that allocated money to support students through tough times. And you can contact the financial aid office to get more information. This goes for international students, DACA recipients, students who don't have financial aid and can't receive the CARES Act relief fund, whatever that was. Some other things that I found was a CSC, which is an organization in Lynn, Benton, and Lincoln counties. And they provide programs and services to help people. And one thing they have is a COVID-19 rental relief program. And so they allocated $500,000 to provide people with rental insurance. So if you guys need assistance, probably check out the CSC's website for their COVID rental relief program. So those are just a couple of resources for people. Since we're talking about this topic, I decided to put them together just to share.
Yeah, will you share the links with us, Ebado? I want to read about it.
Yeah.
Yay.
Yeah, and we can also include that in our description too for people.
I wasn't sure if y'all had a description, so I was like, let me just put all that information out there.
Oh, thank you for the silver lining. It was a heavy topic, so I'm glad that there's people out there trying to do something about it.
Yeah,
Mhm.
that's
Save the
definitely nice.
world.
Yeah, also like there's been a lot of support for Medicare for all lately, and actually 70% of Americans actually support Medicare for all, including Republicans. So that is a good step in the right direction. But with that, we're gonna end this episode. So I want to thank everybody for joining us today, especially Kolade and Ebado.
Yeah, thank you, guys.
Thank you.
Please reach out if you have any questions or concerns, and our website's always asosu.oregonstate.edu, and our Canvas page is regularly updated with COVID-19 updates. So be well and stay safe, Beaver Nation, and as always, go Beavs!
Go Beavs!
Bye.
Bye!
Thank you for joining us today. Please reach out with any questions or concerns through our website, asosu.oregonstate.edu. There are regular COVID-19 updates on our webpage and ASOSU Canvas page. Be well and stay safe, Beaver Nation. Go Beavs!